Hi guys, Dr. Minkoff here. Today we're going to talk about hormones, bioidentical hormones. What are they? How do they work? Are they safe? Most of you have heard about this, but I think it's a really important topic. So just to define right now this idea of bioidentical. So bio refers to biology or living cells or living things, and identical means that they're the same. So the hormones that are produced in the body are natural substances. If we give the body back the exact natural substance, then that we call bioidentical. So if the hormone matches the hormone that we're giving exactly, biochemically, then we're giving the same. If we're giving something else, which could become a drug, we're going to get a different effect, we're going to get different side effects, and we're not going to get the same thing. So this is really important. Now, as people age, their hormone levels naturally go down once they're past their prime of life. So by age probably 20, 30, people are at peak times for their hormones, for their fertility, for their masculinity. And then with aging, normally what happens is that these hormone levels tend to go down. One of the things that we look at when we're talking to people who are in their 40s, 50s, 60s, 70s, 80s, who want to maintain their health, their vigor, their drive, their tissues, if we can keep their hormone levels at higher levels, then their cells will maintain a more youthful performance. Okay? So if someone has a testosterone level that's low when they're 60, and we can do a bioidentical replacement so that it's the same as when they were 30, they will feel that difference. Their heart, their brain, their muscles, their connective tissue will all work better than if their hormone level was low. So this has an anti-aging effect. It also has a real performance effect on the person. Now let's talk about what happens as you go through, in a case of a woman, menopause, or in the case of a man, what we call andropause. Andro refers to male. Both sides can have mood swings, depression, headaches, night sweats, insomnia, weight gain, bone loss. Okay? This is just naturally from lowering hormone levels. Even more with women, forgetfulness, hot flashes, nausea, heart palpitations, irregular periods, vaginal dryness, joint aches, and pain. And probably if you're premenopausal or menopausal, you've experienced some or all of these things. This relates to the lowered level of hormones in your body compared to what they were before. Now, sometimes women have hysterectomies or they have their ovaries removed, and then this would happen just like right away, not as a gradual process. For men, decreased motivation, lack of focus, low energy, muscle loss, mild to moderate erectile dysfunction, and muscle loss. So these are all things that go along with menopause, andropause, or even aging. This is supposed to be a joke, so I don't want anybody to take it personally. The 7 witches of menopause: itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. Okay? So if you feel this way, or you have a partner that feels this way, it may just be their hormones are not at levels that they were at or that they could be at, and they can be helped. Now, so when we talk about bioidentical therapy, bioidentical hormone therapy, what we're talking about is replacing the hormones that are in the body with the exact same things that the body is making. So in a chemistry lab, you can take the body's normal testosterone, and you can make a molecule that is exactly the same as that molecule. And so when you give it back to the body does not know it is not being made by the testicle or the adrenal gland or the ovary. It is being made by an outside chemistry pharmacist, but when it comes in, it looks the same, and so the body doesn't fight it. It's a natural substance. It will produce the same effects that the hormone produced, and if we can get the levels at the level where it should be for that person, we can get a better response in that person's body. Synthetic hormones are drugs. Now, if you're a chemical manufacturer, if you're a drug manufacturer, you can't have a patent on a bioidentical natural hormone. They're natural substances and they can't be patented. So you have to alter the molecule if you're going to be able to call it a drug and get a patent on it and manufacture it and make money. The drug has to have some of the effects of the natural hormone, but since it's not the natural hormone and it is a drug, there will be different effects and definitely side effects. The other thing with bioidentical compounded hormones are we can match the dose to the person. So if the person's having a lot of hot flashes and we're giving them estrogen, we can gradually increase the dose of estrogen so that their hot flashes basically go away. And then we know that the level of estrogen that we have in their body is what their body needs, and they'll be okay. Now, this is just an example of the difference between these hormones. So, estradiol is the natural hormone in the body. Premarin is a manufactured hormone. Now, Premarin, PRE stands for pregnant. MAR stands for mare. And N stands for urine. So where do they get Premarin? From pregnant mare's urine. And they concentrate it and they take the estrogens out of it. Now this is horse estrogen. It's very strong compared to human estrogen. It's also an estrogen that our bodies make very little of. It's called estrone. And estrone is carcinogenic. And our bodies make a little bit of it, but horse estrogen has a lot of it. And I'll show you in a minute. Premarin was one of the biggest selling drugs ever in the history of drugs because many women were prescribed it and used it. It turns out it is carcinogenic, and so it's still used, but it has a black box around it in the PDR. Okay? This is another synthetic estrogen, and so you can see this HO on this side of the natural estrogen, they substituted this sulfur with 4 oxygens and a sodium in order to make it a drug. They also took this hydrogen off and made it just an oxygen. So there's little chemical differences, but it makes a huge difference. This is just a picture of the Premarin pill. And just to show you, this was 2010, but Premarin-derived drugs were $1 billion, almost $1 billion market. $949 million were sold of Premarin. So this was hugely popular. It was prescribed by family doctors and gynecologists to many, many women. There now is a warning on it because it turned out that the drug caused a lot of side effects and could be a problem in women. So in the 70s, it was considered the gold standard for hormone replacement. In 1975, clinical studies reported a link between synthetic horse estrogen, which is Premarin, and uterine cancers. Also increased incidence of blood clots and deep vein thrombosis. So the manufacturer was required to put a black box. Many thought it should come off the market. It is still available. It is still being sold. We don't recommend it because we think that bioidenticals are much safer and they're much more physiologic. I just want to make this point again. A bioidentical hormone is not a drug. Now, we were talking about estrogen earlier. We're going to talk about progesterone now. This is the naturally occurring progesterone. You can see that this drug, which is called a progestin, is different. It's got this thing and it's got that where there's nothing there. So this can be registered as a drug called a progestin, and it's been given to millions and millions of people. This drug's name is Provera. Again, natural progesterone. They put this CH3 on here, and they put this oxygen, carbon, methyl group, and oxygen, so it makes this something that you can patent. Now, progestins aren't just progesterone. Progesterone is very safe. It's part of our natural hormone structure. Progestins are a drug. They're not as safe, okay? So side effects like breast engorgement, headache, rise in body temperature, swelling, reflux, acne, irregular bleeding, lots of things that can occur from progestins. Again, we don't recommend these because bioidenticals are available, they're safe, and we feel they're much better. Now, what about the benefits of bioidentical hormone replacement therapy? Here's some symptoms related to not having enough hormones. Okay, hot flashes, night sweats, these are probably the most common. Insomnia or disturbed sleep, mood swings, decreased libido, wrinkles, weight gain, memory loss, decreased bone density, vaginal dryness, another one that's a big problem in women. Thinning hair, urinary incontinence, facial hair growth, joint pains. So these are problems with bioidentical hormone replacement therapy, not getting it. Want to address this for a minute. Many women suffer from atrophy, which is the tissues in the vaginal area become dry and they become thin, sex becomes painful, and this is reversible by local estrogen treatment. And you can see here the profile of healthy vaginal tissue has a real thick layer of superficial cells and intermediate cells. And with this atrophic vaginal tissue, this is basically not enough estrogen in the vaginal area. You get these layers shrinking from 15 to 5% and 80 to 30%. So many women feel much better when they get hormone replacement therapy. And it's probably 95 to 98% of the women that we give the therapy to are extremely happy with it. So this woman reports, after starting on bioidentical hormones, I feel like I'm 40, she was 55. I can't believe it was possible to feel this good. My energy, mood, libido, muscle tone, and mental clarity have returned. Now, in the normal cycle of a female, the first half of the cycle, estrogen levels gradually rise. There is ovulation, which means the egg comes off the ovary. If the egg is not fertilized, then the levels of estrogen decrease and the levels of progesterone eventually decrease. We find that that in many women nowadays, even starting in their 20s and 30s, that they do not begin to make enough progesterone on the second half of their cycle. And they get what we call PMS, premenstrual syndrome. They might feel bloated or have pain or be having trouble with sleep or trouble with mood or depressed because their progesterone levels are not coming up to where they should to be normal. And those women, if we give them progesterone in the second half of their cycle, their symptoms go away and they feel better. Now, how do we determine this? A lot of times when women come in, what we're looking at is they come in with symptoms. So I'm having hot flashes and night sweats. I don't feel myself. And my doctor did a bone density on me and he told me that it was low. And I don't feel right. Something's wrong with my hormones. So we can measure levels of hormones using either blood or saliva. This is a saliva test, and we can see where are they compared to where they should be. Now, this first one is testosterone. You can see This is a 50-year-old. It's way low. It should be up here. This is DHEA, another hormone. It's way low. It should be up here. This is cortisol. It's way low. It should be up here. What we then can do is give these women bioidentical hormones. In this case, we would give them testosterone and DHEA. Estrogen is not on here. Usually estrogen is low and progesterone is low. We can give these hormones, wait a couple of months, remeasure the levels, and then compare. How do you feel now compared to before? Are your symptoms gone away? Are your levels in a reasonable range? And then that's something that they could continue as long as they want to go on with it. This is one which just shows cortisol. Cortisol is a hormone. A lot of times if people are very stressed out and they're really burned out, they've been either exercising too hard or working too hard or not sleeping, and they feel very inflamed and exhausted, they may have a cortisol level that looks like this. Normal should be up here, and this person is very depleted. And what we call this is adrenal insufficiency or adrenal failure, because the adrenal gland normally makes this hormone and it needs to keep it up. And we can do a replacement with cortisol just like we can with testosterone or estrogen or progesterone. And when we do that, we can get the levels in a functional level, at a functional level, and the person will feel a lot better. And they can then work, and we can actually then allow their adrenal glands to recover so that they can return to a normal life. Okay? So this was just kind of an overview and a wrap-up of bioidentical hormones. These things are natural hormones. They go low. I think because of our stressful lifestyles, this is worse than it's ever been. If you talk to women who 50 years ago went through menopause, it was not the problem that it is now. Again, we're seeing this in young women, like 20-year-old women, 25-year-old women. We measure their hormone levels, they're low. And we can actually help these people to really feel a lot better. And sometimes we can do it with just diet and nutrition. Sometimes we need to actually add back the bioidentical hormones to get them in normal levels so that their bodies will be able to function a lot better. They'll feel better, and they'll be a lot happier. Okay? Hope this helps.